My name's Damian Roland. I'm a paediatrician and I've subspecialised in paediatric emergency care. I work at the Leicester Royal Infirmary. What does the professional values and behaviours domain mean to me? Well, I think this is a fundamental core domain that's going to underpin a whole load of the progress curriculum really. When a child and young person presents to an emergency department, outpatient clinic, wherever, and they come with parents or carers, people want to know that the way that the doctor approaches medicine and approaches their child or approaches them is with a core set of values, that people are truthful, that they have your best interests at heart, that they're going to communicate in the best possible way, be clear about what they're doing. And these all sometimes feel a little woolly and grey and sometimes a bit obvious. Of course everyone does this, but actually that's not always the case. In my experience, I often work in highly stressful resuscitations. We have a very sick child, lots of team members come in, some of those team members haven't met each other before. And how do you communicate with other people in a way that ensures that you're keeping the child or young person at the centre of everything you do? And sometimes people make offhanded comments, they have body gestures, they sometimes show their displeasure in a way that actually their colleagues certainly don't like and may react to, but also that parents, carers and children may see that type of behaviour. And these are all very subtle things, but they're all fundamentally important, because at the heart of paediatrics it is probably good communication. And my belief about this domain, it's all about people being the best they can be. And actually to be the best you can be, you have to have a lot of insight. So as you start through this domain, I think it's all about the doctor themselves. How do they realise their skills and capabilities? How do they communicate? Do they have insight into that communication? And then as you progress through your training, you need to be able to realise not only that in yourself, you need to develop emotional resilience, you need to develop situational awareness, not just clinically, but also emotionally as well. And then finally, you need to be able to recognise potentially poor behaviours in others and call them out, not in an aggressive way, but be able to recognise when other people aren't sharing those similar values and what you do about that.